what kind of sort of significant changes have you seen? Like you're mentioning, there were so many MCH departments, and I remember that too. And then you watch this thing get whittled away, and now there's one, identified. What kinds of changes have you seen, both in policy or in practice, and what do you attribute that to?
So the first thing that comes to mind, and I think because I had just mentioned it and you repeated it about the change in the academic units, is the changes in states. It used to be that you could find the MCH division or unit or whatever on a health department org chart. They all had them. Partly that was a function of the way Title V was created. To get the Title V funding, you had to have an MCH unit to receive the funds. And that went back to the earlier law, which in some cases led to the creation of state health departments where there were none. So it wasn't just that you didn't have an MCH. We didn't even have we've got to have a health department to put an MCH unit in so we can get this money. So there were MCH, and they were called that, Maternal and Child Health, MCH, that you could find them, And there was, I'm trying to figure out when this started happening. Probably even in the 80s, there was a lot of discussion. So there were sort of two things going on. One was a lot of discussion about, well, it's not just mothers and babies. MCH can't just be about mothers and babies. And truth be told, it never was. I don't know why they picked that name. It was probably for some political reason at the time. But it was always about families, about women, about the health of communities. I mean, it was always about that. But somehow that name, Maternal and Child Health, almost came under attack. Well, where's the M in MCH? Where's women's health? Where's fathers? What about families? And you have to remember all the things that were going on at the time around the welfare program. And well, you're forcing people to not be married to get welfare benefits, and women are having babies just to get welfare benefits, and you're destroying families. And so I think, there were all those movements going on. This notion of MCH seemed, just didn't really do what people wanted to do. And then at the same time, there was this just proliferation of states thinking that if they could reorganize themselves out of the economic challenges that they were facing. So, there had been, I'm told there were boom times. I never have seen these, but I was told that there were times when, these health programs were flush with money and health departments had all kind of money. And then, when Ronald Reagan came into office, and there was a lot of downsizing and cutting, and the MCH block grant was cut by 25%, when the blocks were created, and suddenly states were faced with, significant budget cuts, and somehow the idea that if you reorganize, you can reorganize your way out of these. So you saw a lot of reorganization taking place where even whole health departments were merged into other agencies, so to make these large umbrella health and human service agencies. And you saw MCH programs within health departments either being retitled something else because we didn't want to call it MCH anymore, or being merged into other configurations. So just in that time period, you'd be hard pressed to find, if I said to a group of students, all right, I'm going to give you half an hour, find the MCH program. Here's 2 states, go find the MCH program. I think they'd have a hard time finding it. I mean, thankfully, the internet, they could probably find it. But if you had to go the old-fashioned way and find an organization, I think you'd have a hard time finding where it was. And in other cases, it was split up. So it was dispersed. The responsibilities were dispersed. And the language in Title V never mandated that you had to have an MCH program that looked like this with this kind of director. We actually had some discussions about this at one point, about going in and saying, we ought to put in the language that you have to have somebody qualified to run these programs, because when you start splitting them up and you send them hither and yon and who knows where they're going to end up, where's the focus for MCH in the state? Because that's really the beauty of the law, is that it places in each state somebody with the focus and the accountability for the health of all the women and children and adolescents and families and fathers and grandmothers in the state. But when you diffuse that, then that function becomes harder to maintain. So I think that's been in some ways not helpful to us. I think when you don't have that identifiable unit, it's much harder to advocate for it. It's much harder to see it. So that in my lifetime has been a huge, huge change.